Your Majesty, Dr. Kluge, distinguished ladies and gentlemen, the last 18 months have reminded us how precious, and I would say how vulnerable, our mental health is. The pandemic has caused incredible levels of stress, anxiety, depression, and loneliness. We have seen an increase in the reported incidence of violence in women and children. As a clinical psychologist and working with children and adolescents, and now as European Commissioner for Health and Food Safety, I am acutely aware of what this means. Health workers struggling with burnout, parents being overstretched, young people missing out on crucial social interactions and on education, people losing jobs and having difficulty making ends meet, the elderly feeling isolated and alone, patients with other diseases such as cancer feeling stressed at not being able to access treatments. And as in any crisis, it is the most vulnerable amongst us that have suffered the most. We, as a society, will feel this impact for many years to come, and we should be prepared to address it. We, as policymakers, have to learn from any crisis. We need to do more to protect and improve our citizens' mental health. It is for this reason that I am really very pleased today to join you to mark the launch of this very important pan-European mental health coalition and to join my voice with yours in saying mental health matters. I know my concerns are your concerns. We stand together, the Commission, the World Health Organization, member states, stakeholders, governments, and those directly affected. This solidarity holds the power to deliver real change. I saw this collective spirit in 2020 when we built a virtual community in our EU health policy platform to tackle the mental health impact of the pandemic. That community now involves over 90 participants from over 50 organizations, including the World Health Organization. I also saw it 4 months ago when I hosted a high-level conference on the mental health consequences of the pandemic. Nearly 2,000 people from across all levels of society and government listened to the experience of those most affected. WHO's regional office made a major contribution to this event, and I want to thank Dr. Kluge personally for his support. These experiences show how much stronger and how much more impactful we are when we work together. And therein lies the potential of this coalition. Your new European framework aims to transform mental health services and promote mental health well-being, while the new coalition will support exchange of knowledge and good practice. Together, they will place mental health at the heart of the COVID-19 recovery process, and these are central elements in our own efforts. We are supporting best practice implementation in the wider area of mental health. These practices focus now on depression, on prevention, on innovative mental health system reform, and on suicide prevention. Our new EU for Health program provides further tools to support mental health. And this autumn, we will be calling launch a call to support implementation of best practices that tackle the pandemic's mental health impact. Your Majesty, ladies and gentlemen, let me end by saying to those who are struggling, to those who are listening today with mental health challenges, you are not alone. We are here for you. The new Mental Health Coalition is a major step towards addressing the growing mental health challenges across the WHO European region. I wish it every success, and I can assure you that I, as European Commissioner, but the whole Commission as a whole, will continue to work side by side with all of you to provide support for those in need. Because COVID-19 recovery starts from us, from our physical, and our mental health. Thank you.